So what does a typical ACL recovery timeline look like? We hear 9 to 12 months thrown about, but no one actually breaks down what that exactly looks like. I'm Aaron, I've torn my ACL in the past, and I've treated hundreds of patients that have torn theirs. And in this video, I'm going to break down each phase of recovery and explain what that looks like and how long each one lasts. For the video, I'm going to use my own personalised timeline calculator, which I've put a link to in the description below. And you pop your details in and it will generate a timeline specifically for you. So if you tore your ACL yesterday, it will map out what the next 9 to 12 months looks like and break down into phases. So you've got a nice visual timeline of where you should be at what kind of rough date. So you can check that out, like I said, in the link in the description below. So as you go in and pop your details in, it'll ask you either if you've had surgery, when you've got surgery, if you're having surgery. So for the sake of this video, so you can see the full process, I'm going to enter in that I've got surgery upcoming in the next sort of month. So you head over to the timeline calculator, enter your name in, your email address so that you can get your results sent over. Like I said, what kind of status you're at, if you've got surgery coming up, if you've already had it, and then it'll prompt you as to what kind of date that was. So then when you click create, within a couple of seconds, it'll generate your personalized timeline. And at the top, it'll say what kind of phase you're in. So if you're pre-op, it'll say that. If you're kind of sort of midway through your recovery, it'll say that. Obviously, if you're at the end, it'll also outline that and the goals at that stage. But like I said, for the sake of this video, I've put in that I've just torn my ACL, so I've got surgery in the next sort of month. So that way we can talk about what you should be doing before surgery and then all the way through recovery to when you get back to sport. So just a quick caveat, I'm not a massive fan of timeline-based goals. I mention that in almost every video that I put onto YouTube. And that's purely because not everyone's recovery is the same. Some people will hit hurdles, some people will have a really smooth recovery, some people might have multiple injuries like meniscus, other ligaments damaged. So no one's the same. Everyone has different grafts, different surgeons, loads of different variables that go into it. So I prefer to progress throughout a program based on criteria-based goals. So has your extension reached this degree? Have you got no swelling? Can you do this? Can you squat this body weight? That sort of thing. So the time schedule that we're going to talk about is sort of an estimate. So it's just to give you a rough guide as to what you can expect. So the first phase, like I said, we're in this scenario, we're imagining that I've literally torn my ACL today and we're waiting for surgery. So we're in the pre-operation phase. So in terms of priorities, the main one is to reduce swelling, to get that knee nice and calm so that when you go into surgery, your knee's calm down and you're not fighting against the sort of acute symptoms of an ACL injury. So swelling, obviously pain, limited range of movement. So it's kind of to limit those when you go into surgery for your knee operation. We've got optimal conditions, more likely to be a successful surgery. The rehab's going to be more straightforward. So that pre-op stage is actually really important and it's often overlooked. So like I said, we're working on getting swelling down. We want to regain full extension. So that's being able to fully straighten the knee. And that's one of the most important things in the first few weeks after surgery, regaining that again. So if we can get it to a point where you can fully extend your knee before the surgery, it's going to be a lot easier to regain that afterwards. Another thing kind of looking ahead after the surgery is strengthening the quad. So when you injure your ACL, the quad kind of turns off, if you like, for want of a better term, and it tries to protect the knee by just not doing anything. So if your quad was to contract all the time and extend your knee, then that could potentially damage the ACL. So because your brain's really clever, it automatically stops your quad doing that. But when it does that, that means it loses a lot of strength. So if we can fight that happening and build a bit of strength up before the surgery, when we have to catch up afterwards, we're not catching up as much, if that makes sense. Like I said, afterwards, that's really important. You can't really do much with that in the early stage of recovery after the operation, because obviously you're limited to how much you can move, you've got braces on and it's obviously painful and things like that. So if we can build up as much strength as we can before, then if we do lose a little bit, it's not as difficult to regain as if we'd lost loads before and then we lose even more after the surgery. Another one that's often overlooked is preparing for life after the operation. So making sure you've got everything you need so that when you do get home, you're ready to recover. And that could be things like some kind of support pillow or wedge to help you when you're asleep, an ice machine to help with inflammation, again, afterwards when you get home, the kind of crutches and braces that you're going to need. If you speak to your surgeon, they usually recommend sort of a bit of a protocol as to what to do after whatever surgery it is you're having. And other things that again are overlooked, like how you're going to get to appointments and if you've got, when you're going back to work, things like that, things that you don't really think about. So having a bit of a written plan can be really helpful. Understanding what's coming ahead, which is hopefully the reason you're watching this video. So to give you a bit of an idea of the stages of recovery, what's to come, how long it's going to take, how long it's going to be until you can do certain things like walk unaided, for example, get back to the gym, run, things like that. So having a bit of a plan, the earlier the better, really. And finally, planning your support network. So I mentioned it earlier, how you're going to get to appointments, if you're going to rely on friends, family, partners. Having that all in your head, written down, just planned, can be really beneficial. So what's next? The next phase is obviously surgery and the early recovery that comes with that. So that'll be heavily based on reducing pain, reducing swelling, getting range of movement back, and just staying mentally focused. So we'll go through that next. So, once you've had the surgery, you move into the first phase of the actual recovery. Now, like I said a minute ago, the main aims here are to reduce swelling, reduce pain, and regain some of that mobility that you've lost. Within the first couple of weeks, we want to get full extension back, which, like I said before, is where you can fully straighten the knee. We can start doing some light quad work just to get that quad moving and reduce any muscle loss as much as we can. Another pretty big one at this stage is looking after your wound, so wound care, making sure you don't get any sort of infection, and the wound itself heals as well as it can. A lot of the planning that we did before the operation comes into play here, so things like a good support network, having your ice machine to manage the swelling, using that pillow that you might have purchased to help you sleep comfortably and safely, and of course following an exercise program which gives you a bit of guidance throughout your recovery. Weight bearing to some extent could begin here, but always follow a physiotherapist or your surgeon's advice. Some things to look out for are things like excessive tightness, any sign of infection, going through those red flags, keeping an eye that none of those are showing up. And it's pretty common to feel a little bit down, especially in the first week after your recovery, when pain's high, you're uncomfortable, the reality of you not being able to do what you normally can at the minute, that all builds up and you might start feeling a little bit down, but that's completely normal, and just remember it won't last forever. Now this stage typically lasts the first couple of weeks, so once we've got full extension, we've managed the swelling, pain's gone down a little bit, and you've got some quad activation, we can start looking at gait and increasing your mobility in the next phase. So now we're moving into phase 2, and the main aims here are looking at mobility and your gait. And this typically lasts between week 2 and week 6. In terms of range of movement, we should have full extension still, so it's just about maintaining that and then working on flexion, so trying to get a little bit more bend in the knee. And now we can start working on gait, so that's the way you walk. And we want to obviously work towards walking without a limp, and if we can do that as early but as safely as possible, then that will prevent any complications, so leading on to secondary injuries, compensation, muscular imbalances and things like that. So as part of this, we can start weaning off the crutches, obviously at a gradual stage and when safe, which is completely individual to you. It's important to carry on that quad activation, so fighting against any muscle loss, getting a bit of strength back, and it'll also help with maintaining that extension as well. We might be able to start gentle cycling just to get things moving. It'll help with pain, it'll help increase movement, and mentally it's really good to stop you feeling down, makes you feel like you've made a little bit of progress, and it helps maintain a bit of cardiovascular fitness as well. So it's a really good exercise to be doing at the minute because it's non-impact, it's relatively safe, and you can adjust the seat to match your range of movement. Some common issues at this kind of phase are stiffness and a little bit of pain in the mornings. You might feel a bit tight. You might feel a bit frustrated with the speed of progress. But as I've said before, it's a marathon, not a sprint. So it is frustrating. You're only in the early first few weeks of recovery. Remember, we're looking at sort of a 9 to 12 week window. So just focus on meeting the short-term goals, and before you know it, we'll be at the end. This is the kind of stage where swelling after exercise or activity is pretty common. That's not always the end of the world. It's just monitoring how severe that is. So if you're getting quite a lot of swelling, a lot of pain, it's lasting quite a long time, then that's a sign that you need to dial things back a little bit and slow things down. It's likely, especially in the first few weeks of this current phase, that you'll struggle to bend that knee, and that's because you might not be ready for that in the minute. There will be some inflammation in the joint, and if there's some fluid and inflammation in between that joint, then that's going to get in the way of your knee bending. So don't panic, it's completely normal. We're going to work through that gradually, and the amount you can bend your knee will increase over time. It's just really important not to force that, because forcing it and pushing it too far will actually have the opposite effect and will reduce the amount of range of movement that you've got. You might notice you've got a bit of a limp that is kind of lingering and you're struggling to get rid of it, you're struggling to walk properly. But that, again, is really common and will improve over time. It's just, like I said, important not to aggravate it because that's only going to make things worse. And the longer you're limping, the more likely you are to have compensatory issues, muscular imbalances. So it's important not to force that. Just follow the program you're following as closely as you can. Don't force anything. Try to manage the symptoms like pain, inflammation, because they're often the sources of the problem. So as we get to sort of the end of that phase, so around 6 weeks, your movement should have increased a bit. Your swelling's obviously reduced and continues to settle down. So now we're going to concentrate on building some strength back up. So now we're into phase 4, and that is the strength building phase. And here we're going to build foundational strength, control, and confidence. And ideally, we're going to do that through gym-based work. So here we can start progressive strengthening. And we can do that through exercises like squats, leg press, step-ups, and some single leg strength, which helps us both avoid any muscular imbalances, identify weaknesses in your injured leg, and also helps us work on stability as well. We should aim to carry on that full extension and maintain it there, and also work on developing that knee flexion if needed as well. As strength builds, so should your ability to tolerate load. And that's something, again, that we're working on. We're not always working to build strength and getting as strong as possible, although we obviously are. We're also working to get your knee to a stage where it can tolerate what we're putting it through to. And as well as the knee, we want to work on some core strength and some hip strength, which all have a role to play in knee stability and your overall strength. Common issues here are obviously going to be some muscular imbalances, so your injured quad will quite likely be significantly weaker than your uninjured quad. It's quite common and completely understandable to be a bit fearful of loading the knee, so you obviously don't want to get injured again. So it's just important to start slow and gradually increase it when it's safe to do so. Pay attention to technique. Make a note of how you're feeling after the session. So if you're in pain for a day or two, you get quite a lot of swelling, it just doesn't feel very good, then that could be a sign that you've pushed it too far. So keeping a diary. So keeping a diary might be really helpful, even if that's just in the notes on your phone or you have a physical diary. That can be quite handy just to look back, make notes of when things got worse. And if you are working with a physio, then it's always good to reference them as well. Again, thinking about the mental side of the recovery, it's quite easy to compare yourself to other people, especially when we're on social media, we're looking at other people in the same boat, recovering from ACL injury too, and it's easy to compare yourselves to them, which is never good in any situation, but especially when it comes to ACL injury. We've discussed already that it's quite easy to get down and feel a bit rubbish about yourself, you can't do what you used to be able to do, so just comparing yourself to other people is not going to help that. So just concentrating on yourself, look at the progress that you've made so far, where you've come from day 1 to where you are now, between weeks sort of 6 and 12, and just concentrate week by week. Don't look 6 months ahead, don't look at other people, just concentrate on yourself at the minute and aim at reaching the goals and the objectives of the current phase that you're in. And finally, again, on the mental kind of side of things, at the start, you make progress relatively quickly, really. So within a couple of weeks, you've got full extension back, so that seems like a really big milestone. And then as we get to now, the sort of mid-phase, if you like, between 6 and 12 weeks, things start to level off a little bit. And it's quite easy to think progress is slowing down, this is a negative thing, but it's not. It's just part of the process. Imagine you're building a house. You're currently building the foundations, make sure everything's secure, all the foundations are there ready to go. It looks like you've not done anything, but without that, you can't build the rest of the house. So that's all we're doing now. We're building strength so that when we do start escalating things, it's safe and it's a lot more effective. And once we've built strength and we've got those solid foundations, then we can start progressing things to more higher impact and higher energy things like running, which we'll talk about in the next phase. So now we're in phase 4, and that's running preparation. Now we're not ready to run yet, but we're going to start working on things to put ourselves in a position where we are. So we're going to work on the strength, the capacity, and the control to be able to cope with the demands of running. So we're going to start working towards some single leg strength benchmarks. So we're going to work on single leg squats, single leg press, calf raises, and hop tests. Also, we've got that single leg strength because running is obviously a single leg sport. So if we get our injured leg strong, as strong as the uninjured leg, then when we do start running, we're not going to have any problems. We worked on the tolerance of the knee in the last phase, so now we're going to work on that a little bit more, so that it can cope with the more dynamic plyometric movements that running requires. So we can do this through drills like skipping, hopping, different progressions of hopping. I discussed earlier on at the start of the phases that cycling can be really beneficial, and one of those reasons was to maintain cardiovascular fitness. So now we're going to build on that. So we're going to get it back up to a level that when you do start running again, you don't feel like you're starting from scratch completely. So we can do this by continuing to cycle as we have for the majority of the recovery. We can get on things like the cross trainer, potentially do some swimming, which can be really good because obviously it's no impact, and just develop our cardiovascular fitness that way. We're also working on confidence throughout the recovery, but especially in this phase. So you're building your confidence so that you know your body's in a position where if you do start running, it's going to be fine. And I talk quite a lot about the mental side of recovery because it plays a massive part. And then towards the end of this phase, which typically lasts between month 3 and month 5, we'll work towards some clinical tests to make sure we're objectively ready to start running again. So we're not just going, oh yeah, I feel like I can run, let's go for it. We're going to make sure we can meet certain tests that have been scientifically proven to suggest that you're safe to run again. So we're going to work towards them towards sort of month 5, if you like. But as always, it's important to know common issues people face in this phase. And a big one is impatience. So you know, I'm soon going to be able to run again. So it's quite easy to force that and trick yourself into thinking you're ready to do it before you actually are. I've said millions of times that recovery is never linear, not in any injury, but especially in ACL recovery. So you will hit some niggles when you start progressing things and we're doing higher energy movements. So things that are more intense, more dynamic, they're going to niggle in some way. It's just limiting those as much as you can by doing them safely. You're probably going to be a little bit worried about what running will feel like, which again is completely understandable. 3 months ago, you would never even think about running. So now you get into that, you're going to start worrying about it a little bit more. But again, as long as we get through this phase safely and do all the exercises well and we get those foundations built, then running shouldn't be a problem. It's just about preparing your body well enough so that when you do start running, it's ready to go. And another thing that gets overlooked is that your body weight changes throughout any injury, especially when you've been slightly less active for the last 3 or 5 months. You maybe change the way you eat, your body will have changed, you might have lost a bit of muscle mass in general. So these all play a part into running. If you were, say, 12 stone when you got the injury and you've now put a stone on maybe in the recovery process, you're now 13 stone. When you start running, not only have you got a knee that's been through surgery and rehab, your whole body is slightly heavier. So it's just things to think about. Because it's not just your knee that's going to have to take that weight, it's the other joints as well, your ankles, your hips. But again, as always, if you know that and you're prepared, then you can kind of work with it. So now we're working to phase 5. And as long as you've met those strength and control criteria, and you've been cleared to return back to running, then we're good to go. Now, phase 5 is the return to running and plyometric phase. And that's typically somewhere between month 5 and month 8. And here we're going to gradually return to running, not just go straight into running a marathon. We're going to have a structured return to running program. We're going to include changes of direction and also explosive movements like plyometrics. The returning to running aspect might include part walk, part jog sessions, things like intervals or fartlek training, and then some low intensity continuous running, which we can increase over time. We'll include progressions so that your joints and connective tissue are all getting conditioned to adapt with the increased running load that we're going to progressively input throughout this phase. So that will include things like jumping, landing, and bounding. You'd like to work on agility and change of direction drills, but you'll also maintain the strength around this. So we don't want to build up loads of strength, get nice and strong so that we're prepared to start running again, and then just stop and potentially lose all that. We want to balance them both together. So we're still going to work on strength, but just around the running that we're introducing as well. And as always, we're going to monitor the symptoms and how you feel after sessions, the day after sessions, before sessions. Again, using that diary that I suggested previously, just making a note of how certain things are making you feel, if you're struggling with some, if you feel good with others, and that can be really useful moving forwards. Now, running is obviously a lot more intense than some of the gym work that you've been doing, so it's really important to understand that, again, you might feel some niggles, you might get a bit of swelling back, you might feel a little bit sore, especially after the first few runs that you're doing, but it's just important to work with that. So if you feel sore, then maybe don't go and do an interval session next. Just monitor that, use it. You might need a few more days rest earlier on in the return to running section, because the last thing we want to do is return to running, push it too far, get injured, and then go back a step. Your running gait might feel different. Your knee has obviously gone through quite a lot of changes. We've done loads of strength work and we've tried to manage the gait as well as we can, but it's likely that it will feel a bit awkward to start with, and it's just trying as hard as you can to stick to your normal gait. And if it feels uncomfortable, just tone it back a bit. Could potentially have quite a bit of calf and hamstring tightness following each of the run sessions, especially, like I said, at the start of returning to running. So it's just important to manage that through your usual recovery methods. So stretching, ice, massage, things like that. You'll likely feel quite hesitant when you first go into the change of direction drills, so cutting and turning and things, which again is completely normal, but just go into that. The first few ones you do, take it nice and easy, go a little bit slower, just to build a bit of confidence, because that's just as important as your physical performance. If you're mentally worried about things, then you're going to hold back and then you're not going to get as much out of the session. So just go through it as part of your warm-up, just nice and slowly, and that'll build confidence, and when you do go into the sessions, you'll get a lot more out of it. But on the flip side, you might get a bit overexcited. And again, that's normal. It's the most you've been able to do for the last 6 months. But just make sure you try and hold back. Go steady. Take the first few ones, like I said, nice and slow. Just build confidence, build your body's resilience. It's a marathon, not a sprint, as I keep saying, and that'll just limit your chance of re-injury as much as you can. Now, we've worked on return to running. We're now running again. The next phase is returning to sport. So phase 6, the final phase in the recovery, is return to sport. And this is, like I've said, somewhere between 9 to 12 months and beyond. So we don't want to go from the running phase that we're in previously straight back to doing sport. There's a gap in the middle, and that's where we get our body back. We can progress the running drills, do some sport-specific work so that you are safe to go back to sport. So we'll do that through sport-specific drills, some kind of scenarios which simulate a sporting environment. So if you play tennis, you might do some serving, some side shuttles, run into the net and back, things like that, that simulate movements that you would do when you play in the sport. Similar to football. If you're a defender, you might practice some jockeying, you might do some sprints down the wing, you might do some jumping up, heading the ball, moving back and forwards and pivoting. And they're all copying what you would do in real life game situations, so that when you do that, your knee's conditioned to be able to cope with it. Towards the end of that, we'll do some return to sport testing, so that, again, similarly to the previous drills, doing sport-specific work, but making sure we can meet certain guidelines. So depending on what the sport might be, it could be that you can squat 2 times your body weight, or you can hop a certain distance, or even a psychological readiness quiz, just to make sure that every single box is ticked and you're safe to return. Then when we do start return to sport, we don't want to go straight into 90 minutes of football. You might start with training, and then you would go and do 20 minutes, and then the following week you might go and play the first half. Having a graduated plan before you go straight back into sport is the perfect way to build fitness, build your body's resilience, mentally prepare, and just limit that risk of injury again. But now, because we're back in sport, we don't need to completely scrap all the strength work that we've been doing for the last 12 months. It's important to carry on doing that. It's going to take some maintenance. I'll be honest, you're probably going to have to do that forever, just as an injury prevention approach, really. So doing the strength work that we've done before, just progressing that. You might need to adapt it, because we don't want to be maxing out strength sessions, obviously, if we're doing sport and training and all the rest of it that comes into it. But doing some sort of strength work is always going to protect your knee as much as you can. Now, the most common issues here, especially the first time you go back to sport, are that you're concerned that you're going to re-injure it. And to be fair, I think we can all let you off, because nobody wants to work 12 months or more to get back to doing the sport they love to do the same injury again and start the whole process again. So just be assured that if you've followed a program as well as you can, you've met all the criteria. That's based on hundreds, if not thousands, of people in your situation in the past. So those objective criteria, the tests that you do to say that you're safe to return, are there for a reason. That just gives you a little bit of confidence that you know your body's in the best position it can be for you to return to sport safely. You're probably going to be a little bit rusty. You can do all the physio work you want, you can do all the pre-match drills, you can meet criteria, but your first touch is going to be a bit rusty if you're coming back after 12 months out straight into a football match. And that's just how it's going to be. The only thing you can do about that is just working on it in training. You just kind of need to accept the fact that that is going to happen, because the skills need to catch up because you've just had however many months off doing it. It's a bit of a concern, but it's just how it is. And the only way to improve that is to keep practicing, staying confident, and just pushing through it. And similarly, you're going to be worried about your knee. Obviously, that's natural. And the first time you're going to probably worry about it quite a lot, and then the next time a little bit less, and the next time a little bit less, and eventually you won't even think about it. As I keep saying, a bit of a consistent theme, just stick with your program. Make sure you do the work, you meet the tests, you progress in the right amount, you don't jump ahead, you don't hold back. All these things just improve confidence and put you in the best position, so there's nothing to be worried about. So hopefully that gives you a good overview of the kind of timeline to expect. As I said, it's important to take the timelines, if you like, with a pinch of salt. It's more important to concentrate on the criteria stuff, so getting that full extension back, working on knee flexion, making sure you meet the strength markers, and just ignore the time frame itself. But as a rough guide, it's kind of a 9 to 12 month process between surgery and returning to sport. But that's not the end of your rehab. You need to carry on doing it, working on strength, keep doing that pre-op work, doing weekly strength sessions, weekly conditioning sessions, probably a bit of mobility, just to kind of keep that knee strong, make sure you're not losing any strength, make sure you're not losing any muscle mass, and make sure you're not just wasting the last 12 months of work. Hopefully you found that helpful. If you want to learn more about how much mobility you should have in your knee, how much you should be able to bend it week by week, then you might want to watch this video here, which is where I talk you through it.